Good afternoon. My name is Dr. Szabolcsba, consultant surgeon working in the Medcare Hospital group, and I'm a colorectal surgeon and proctologist. I've been doing the proctology care, what we are talking about today, this hemorrhoid and associating symptoms and the diagnostic procedures. So I've been doing for 22 years right now, the proctology, and throughout this long period of time, I realized how big leap has been made in the treatment and in the diagnostics. So today we will give you just to all of you. Hopefully you can hear me properly and you are totally fine and healthy at your home in the home quarantine. So we keep this session in the middle of the coronavirus crisis. But hopefully it will be some plus information for you from the hemorrhoidal problems or piles, which is a very common, I would say the most common surgical problem nowadays. We treat a lot of patients with these kind of issues. The proctology is a very popular area in the general surgery. And regarding the technology and the diagnostic procedures, we can provide in the Medcare Hospital a very comprehensive and very modern, up-to-date kind of treatments. So actually, if we are talking about the hemorrhoids, everyone has some idea of them. I would say if someone feels any sensation around the rectum, what we are talking about, they will come to the doctor. It's just question of time. And they will come, 100 of them, almost 100 of the percent of the patients with hemorrhoid symptoms. So never been diagnosed as hemorrhoids, but it's a very popular, self-diagnosis. I have hemorrhoids. So once they arrived, only the 30, maximum 40% of these patients will be diagnosed with real hemorrhoids. So the key of the treatment, the very beginning of the treatment is getting a diagnosis and of the patient. In the Medcare Hospital, we have a diagnostic unit. It's called, further to the normal investigations with the manual investigation or examination and the proctoscope, which is a small tube that we insert to the rectum, and the lowest 6 centimeter we can examine in the rectum. So the patient can be diagnosed with a very complex unit. It's a tower where we can do a lot of type of examinations together. So it looks very, very scientific, and I don't want to give you just the details because it's very, very boring for the public. But the main issue is we can get a 100% nice diagnosis, and we can save the data for the future, and we can compare later on. For example, if once the surgery has done, then we can we can compare the original findings and the new situation after the surgery. What are the major symptoms? What brings the patient to the doctor? The first is, which is very common, some discomfort in the rectum, some pain. The second one, which is very frightening and it makes them scared, actually, the bleeding. The bleeding, which can be a minimal amount, fresh blood in the stool or just on the toilet paper, or a larger amount. Of course, in these cases, the patient will end up at the emergency department and will be seen by the surgeon or a gastroenterologist. Also, the patient can complain of some difficulty in the defecation or some discharge or liquid which is coming out of the rectum. So once the problem diagnosed, then we can start to plan which type of surgery or treatment or non-surgical conservative management should be prescribed to the patients. Because if we see the diagnostic steps, then we can grade the patients. If someone has hemorrhoids, then we can give 4 grades. It means the severity of the hemorrhoid problem or disease. The first grade hemorrhoid, almost everyone has first grade hemorrhoid. I would say this is the near normal situation. It doesn't need any care, just probably changing in the life habit and just high fiber diet. So changing on a little bit the diet and the lifestyle. For example, if they can start some sports and losing some weight and changing the diet, then it's enough. Second grade hemorrhoid, it gives significant symptoms to the patient. Time to time it can bleed, you know, and some discomfort can happen, and occasionally the patient feels something comes out but immediately retracts to the rectum. So it's a kind of protrusion in the anus. The third grade, the grade is where we start to think about and to consider a surgical intervention or some kind of surgical treatment. The first 2 grades, they need mostly conservative management. The third grade hemorrhoid comes out after the defecation, bleeds frequently, and causing pain or continuous discomfort to the patient. Something went wrong, they feel, and they will definitely come to the doctor, to the surgeon, to fix this kind of problem. So for these patients, the grade 3 category of patients, they definitely require some surgical. The 4th grade is the last grade of hemorrhoidal disease. Definitely we should offer some surgical intervention, some good new technology surgery for these patients, because it can guarantee the lifestyle and the life quality to the patients. Without surgery, I usually say to my patients, if it's not very painful, they can hide for years, even for 10 years. They can live for 100 years without any kind of surgical intervention for the hemorrhoid problem. And it's not life-threatening, to be honest, but the life quality is very poor. So living with hemorrhoids is not a modern, people's lifestyle. I mean, it can't compare to the to the 21st century. So for sure, for hemorrhoid problems at the Medcare hospital, all the surgeons can provide you a comprehensive, very nice care. And just regarding the surgical interventions, we have to talk about basically two major types of surgeries. I would say the old-fashioned surgeries, they were remove something from the rectum surgically. I would say that one was quite drastic, and they just removed the complete hemorrhoidal tissue from there. The new technologies, so that was structural. The new technology, which has been here for just a couple of years, is the functional treatment of the hemorrhoids. Definitely, at the Medcare hospital, in the Medcare hospital, we are performing almost every day this new technology surgeries, which is the functional surgery for the treating of the hemorrhoids. In the further minutes, my colleague Raed will ask from me some questions which may interest you deeply.
Hi, doctor. How are you?
I'm fine.
Thank you so much for the simple, basic information that I believe many of us keep it secret, or we keep it for ourselves. Many people we know in our life, they might have pain issues, as doctor mentioned, minimal bleeding, but they just keep quiet about it. It's no shame to consult a doctor. Yes, you can tolerate the pain, but I think you cannot live long with it. You are changing your lifestyle just to accommodate the pain. Doctor, can you tell us more about the advanced diagnosis we do?
Yeah.
How was it in the past, and what are the new things recently in the market?
In the past, actually, the diagnosis, making the diagnosis of the hemorrhoid problem was taking the history of the patient, how long has it been there, you know, the problem, and actually they just did a manual investigation or examination, and with this proctoscope they identified the problem. That was the only thing what they did. With this new modern device, what I mentioned previously, it's a very complex and big method or examination method. So it's called the proctostation. The proctostation includes some manometry, what we can use for examining the pelvic floor muscles and the function of the sphincter muscles. You know, what is closing the rectum and keeping in, actually, which keeps on the continence of the patient. And we have an ultrasound scan, for example, for ladies, because the pregnancy and the constipation makes the ladies prone to this kind of problem. So I would say 60% ladies with hemorrhoid problem and just only 40% for male. So after deliveries, the pelvic floor muscles can be loosened a little bit, can be torn. I mean, some damage can be happened during the normal deliveries. So with this ultrasound scan, we can detect it very nicely, and we can make a report for the patient for the later comparison of the new situation when we repair the rectum. And also we have a video proctoscope. It's a camera what we inserted to the normal proctoscope, and we can record our data. So it's for sure no chance for overdiagnosis or something. So the third grade is third grade. The fourth grade is fourth grade. So in the Medcare hospital, no one does, upon a misdiagnosis or just a overdiagnosed case, any unnecessary surgery.
So it's not just normal physical diagnosis,
no,
then assumptions.
It's more than that. It's
more on ultrasound, camera,
everything together. Everything
cool.
together.
Doctor, you mentioned that cases in women are higher than men.
Yeah.
Can you tell us more about pregnancies, deliveries? How does this harm females? What treatments can we
see? This
give
one
them?
is well known among the ladies. Even just one delivery can damage the sphincter, the pelvic floor muscles. Just imagine if the baby's head is just going through the canal, you know, the normal pelvic canal. So the human tissue is very flexible, but over a point it will be damaged, and the muscle also. And it can be a hidden
tear.
Yeah, it's a tear, yeah, in the muscle. So it can be a hidden problem for long, but later on it can cause some incontinence and fecal incontinence. And this device, the proctostation, is very good for the detection of this and making the diagnosis of the pelvic floor damage.
And doctor,
and of course, sorry,
yeah.
And of course, if here a lady delivers many babies one by one, then multiply times for the damage.
Exactly. And doctor, can we say it's misdiagnosed in the population, in the community here? Where do usually ladies go? Which doctors do they approach, and which doctors they should go to? I believe, listening to you, they should go to a general surgeon. But do they go first to a gynecologist, or how it should be?
I think if the problem is just localized in the rectum, so as a hemorrhoid problem, then the best doctor is to visit is the surgeon, general surgeon, proctologist, and a comprehensive proctology clinic like we have in the Medcare hospital.
So even after a delivery, if you don't know any, or you can ask your gynecologist to
many
take
patients
about this.
Just referred by the gynecologist, of course, because they will realize the problem. Even they can't treat it, but they will send the patient to the surgeons.
For sure, they will give guidance.
Yeah, of course. So they have a basic picture of that. but of course they will refer the patient. So the patient will land up with the surgeon. My suggestion overall, just to visit bigger hospitals with our symptoms, I mean even a proctology problem, because they can get a comprehensive A to Z, I mean treatment and everything.
Exactly. Doctor, how about the advanced treatments? We spoke about diagnosis. What are the new techniques, new things in treating hemorrhoids? We read a lot online, newspapers, laser treatment, same-day surgery, painless, no bleeding, no suture, a lot of names and descriptions.
All these sayings and informations are unfortunately false, because all surgical intervention will cause some kind of sensation to the patient. I wouldn't say it's a severe pain, but something they will feel. So I never promise to my patients, for example, it's totally pain-free. It's not true.
That's
So
what I want, to be realistic.
Yeah. Some kind of moderate pain, what we can manage nicely. It will be happened after the surgery. So it would be a lie if we just guarantee someone just prior to the surgery that you won't feel any pain and things. No, every surgical intervention carries the risk of, not risk, but it's normal having some kind of sensation. But we can say the new modern technique, what I'm talking about later on a little bit, this one causes incomparable less pain than before. So the old-fashioned hemorrhoid surgeries, where they cut off something from there, the patients were in agony pain for 2 weeks. That was a horrible, and bleeding and blah blah blah. With the new techniques, which the common aim is, with the new technology, reducing the blood flow in the tissues, and we reach this with closing the supply artery of these internal hemorrhoid paths, because they got a lot of blood, and that's why they became swollen, and that's why they can slip out from the anus. So this one is something, what we control is the function. We close the artery one by one with this new technology. We are looking for them, the tiny arteries. We are talking about 2-3 millimeters artery, the caliber, the diameter, with a sonar, with an ultrasound scan. What the public calls as laser, because laser is a very fancy expression.
Exactly.
But to be honest, the laser is that what we don't use for hemorrhoid surgeries, because there is something which is on the halfway of the laser and the normal light is a high intensity light, what we can use for closing this artery. Because once we identify the artery, then we can have 2 options or 3 options. The first option is just making a tiny stitch with a thread, and it's a dissolvable something, and it closes the artery for sure. We can use the high intensity light, what's called laser, for closing this artery, but it's not 100%, it's just only 60-70%. So it can be recanalized and reopened. The third option would be some cryo, so freezing of this area. But my opinion is the best one is putting a underlying stitch and closing the artery for sure and safely. So this is the new method. It's called many names and modifications of this, but it works with the ultrasound scan, safe, minimal invasive, and as the new guidelines just suggest for all grades, the 2nd grade bleeding hemorrhoid, 3rd grade, and 4th grade with a big prolapse. So when it's hanging out, actually the lump, we can use.
That's the last grade.
Yeah, last stage, and that's it can be painful. That's causing pain. The pain is something which is not very typical for hemorrhoids. So if the patient would come, because all patients would come with, I have hemorrhoids, that is their idea of the problem. But probably it's just a tear there, anal fissure, it's called, or some kind of other issue, but not hemorrhoids. If it's a sure hemorrhoidal problem, then it's not very painful. The late stage, the last stage with the big prolapsed lumps, that can cause pain, severe pain.
And doctor, can you quickly tell us about the recovery? Is it really
The
same day going home, back to normal
same
life and
day,
so?
even same day or next morning, the patient can go home. Moderate pain, 0 to moderate, I would say. Some sensation will be there because we do a manipulation there. So the process, how they feel, it depends on the sensitivity of the patient. Someone doesn't feel anything, they are not complaining, they don't ask any painkillers. Someone has some moderate pain, but on the next morning, everyone can go home. And my experience is after 2-3 days, they can return to the normal activity.
Sitting, driving,
Sitting, driving,
everything.
absolutely fine. Just only the anesthesia they can't drive on the same day because it's like it's causing some dizziness
Yeah,
and
exactly.
some So, but after 2-3 days they can go back to normal, I would say.
Perfect. I really appreciate it, doctor. It was so informative. Never be shy, never compromise or tolerate that pain for long. It can be a very quick procedure that is one day, next day you go home. Take care of your lifestyle, a lot of fibers as per Dr. Pap, and be safe. Thank you so much. Thank you,
You very
doctor.
much.